Question. A patient with chronic obstructive pulmonary disease, COPD, is receiving oxygen therapy at 4 L per minute by nasal cannula. The patient is drowsy and has a respiratory rate of 10 breaths per minute. What should the nurse do first? Options. A. Increase the oxygen flow rate. B. Encourage the patient to take deep breaths. C. Decrease the oxygen flow rate. D. Assess the patient's airway and breathing. Answer C. Decrease the oxygen flow rate. Rationale. Patients with COPD are at risk for oxygen-induced hypercapnia due to their reduced ability to exhale carbon dioxide. High levels of oxygen can diminish their drive to breathe, leading to respiratory depression. If a COPD patient becomes drowsy with a low respiratory rate, decreasing the oxygen flow rate is the appropriate first action to prevent further respiratory depression. Question 6. A patient is admitted with a diagnosis of diabetic ketoacidosis, DKA. Which of the following laboratory findings would the nurse expect? A. Hypoglycemia and hyperkalemia. B. Hypoglycemia and metabolic alkalosis. C. Hyperglycemia and metabolic acidosis. D. Hypoglycemia and metabolic acidosis. Answer C. Hyperglycemia and metabolic acidosis. Rationale. DKA is characterized by high blood glucose levels and metabolic acidosis due to the accumulation of ketones. Question. A patient with chronic kidney disease, CKD, has a potassium level of 6.5 milliequivalent/L. Which of the following medications should the nurse prepare to administer? Sodium bicarbonate. B. Calcium gluconate. C. Regular insulin and dextrose. D. Furosemide. Answer. C. Regular insulin and dextrose. Rationale. Regular insulin with dextrose helps shift potassium from the extracellular to the intracellular space, temporarily lowering serum potassium levels. Calcium gluconate stabilizes the heart, but does not lower potassium levels. Sample NGN-style nursing questions and answers. The NCLEX, National Council Licensure Examination, is an exam used to determine if a candidate is ready to begin practicing as an entry-level nurse. The Next Generation NCLEX (NGN) is an updated version that incorporates more complex case studies and questions designed to better assess clinical judgment. 1. Case study, postoperative patient. Patient information. 65-year-old male, status post-hip replacement, currently 1 day post-op. Reports pain level at 7/10. Incision site is red with slight drainage. Vital signs. BP, 140/88 mmHg. HR, 98 BPM. Temp, 38.2 degrees Celsius 100.8 degrees Fahrenheit. RR, 20 breaths per minute. Labs. WBC 12, 500/mm superscript 3. Hemoglobin 13G/DL. Question. What is the nurse's priority action? Answer. The nurse should assess the surgical site for signs of infection. The elevated WBC count, increased temperature, and the redness with drainage at the incision site indicate a possible infection. The nurse should also report these findings to the healthcare provider. 2. Case study, medication administration. Patient information. 45-year-old female with a history of hypertension, prescribed lisinopril 10 mg daily. Vital signs. BP, 150/92 mmHg. HR 70 BPM. Recent labs. Potassium, 5.5 milliequivalent/L. Creatinine 1.8 mg per deciliter. Question. What should the nurse do before administering lisinopril? Answer. The nurse should hold the dose of lisinopril and notify the healthcare provider. The patient's potassium level is elevated, which can be a side effect of lisinopril, an ACE inhibitor, and the patient also has an elevated creatinine level, indicating potential renal impairment. 3. Case study, respiratory distress. Patient information. 60-year-old male, admitted for exacerbation of COPD. Current complaints include shortness of breath and chest tightness. Vital signs. BP 130/85 mmHg. HR, 110 BPM. RR, 30 breaths per minute. SpO2, 88% on room air. Question. What is the nurse's priority intervention? Answer. The nurse should administer oxygen and position the patient in a high Fowler's position. The patient is experiencing respiratory distress, as indicated by the high respiratory rate and low oxygen saturation. Supplemental oxygen will help improve oxygenation. 4. Case study: pain management. Patient information. 70-year-old female with osteoarthritis. Prescribed morphine 2 mg 4 PRN for severe pain. Assessment findings. Patient reports pain 0.8 in her knees. RR. 10 breaths per minute. HR. 65 BPM. Question: what is the nurse's priority action? Answer: the nurse should hold the morphine and reassess the patient's respiratory status. The patient's respiratory rate is already low, and administering morphine, a respiratory depressant, could worsen this condition. The nurse should consult with the healthcare provider before administering the medication. 5. Case study: diabetic patient. Patient information. 55-year-old male with type 2 diabetes on insulin therapy. Current blood glucose level: 60 mg per deciliter. Symptoms: patient is diaphoretic, shaky, and reports feeling lightheaded. Question: what is the nurse's immediate action? Answer: the nurse should immediately give the patient a fast-acting carbohydrate, such as orange juice, and recheck the blood glucose level in 15 minutes. The symptoms and blood glucose level suggest hypoglycemia, which needs to be corrected promptly to prevent further complications.